Ercp is essentially called endoscopic retrograde cholangiopancreatography. It's a procedure that uses an endoscope and a fluoroscopic machine, which is essentially an X-ray machine, to visualize the biliary tree and also to treat conditions along the biliary tree. Before 2018 that we started Ercp in Nigeria, most of the patients that have condition needing this procedure essentially has to undergo surgery. And this condition include cancer of the head of pancreas, stone in the biliary tree, and sometimes some of the patients that have complications following surgery along the biliary tree will need this procedure. Ercp is performed under general anesthesia. Patient is put on the bed, is put under anesthesia that will make them to sleep. After the patient is asleep, we position the patient in what we call semi-prone position, and then we'll have the endoscope. We'll pass the endoscope through their mouth right into their duodenum, the second part of the duodenum. We face the ampulla and then use what we call sphincterotomy and guide wire to enter into the common bile ducts, and then decide from what we can see on the X-ray machine. We inject contrast into the biliary tree to be able to highlight the biliary tree and identify where the problem is. And when we see the problem, we'll decide what to do. Is either to put a stent in there, or to remove the stone that is obstructing it, or to just open the place wider, which we call sphincterotomy. So immediately we face the ampulla and we are able to enter into the bile duct, we'll start evaluating the condition, then we perform necessary treatment as the patient may need. One of the very rare cases that we do on a routine basis is cholangiocarcinoma. Cholangiocarcinoma, especially the one we call hilar cholangiocarcinoma, is an obstruction along the biliary tree between the junction of the right and left bile ducts. This condition, majority of it, if not all of it, presents in a situation in which surgery cannot be offered. Up till the introduction of Ercp, most of those cases are just given some chemotherapy and they are allowed to die without any form of remedy. But since we introduced Ercp, we've been successfully been able to stent many of them and give them a real hope. Majority of them present with terrible itching, itching that is so bad that will not prevent them from sleeping. But since we introduced this, we put stents in there, the itching disappear, and we can give them other remedy to help them and prolong their life. This is one of the things that we pride ourselves, probably the only institution that is offering that in Nigeria, and we hope we'll be able to do more along that line.
The area that interests me most about this Ercp are about 2 patients that we have taken care of that sustained biliary tree injury from 2 private hospitals, and they were leaking bile into the peritoneum. And you know, bile is supposed to be discharged into the duodenum for emulsification of fats. So we have saved the life of these 2 patients, and today, to the glory of God, they are doing very well.
Now, Ercp is very important, very key, because it's an equipment that can help solve many problems that will have needed to go, that will have undertaken unnecessary surgery. And since we've been able to introduce this, we have been able to save lives. We've done close to 400 cases, and a lot of people have gotten remedy to their condition since we introduced this Ercp. As of now, Oauthc is the only institution that does Ercp on a routine basis, and we are hoping that we can have facility to expand our capacity so that we can be a training center. In fact, Oauthc as of today is a leading and a training center for Ercp.